Thank you.
Now I call upon Dr. Baisali Vishwas. She will be speaking on the incidence of peripheral neuropathy and its effect in the severity of retinopathy in type 2 diabetes mellitus patients.
Hello everyone. Today my topic is incidence of peripheral neuropathy and its effect in the severity of retinopathy in type 2 diabetes patient. We know worldwide diabetes is a burden. Around 537 million people are there. And in India also, it is around 101 million according to the study. And diabetic retinopathy is one of the major leading cause of blindness worldwide. So we know that diabetes causes a sequential of complications starting from neuropathy, then retinopathy, and then nephropathy. And diabetic peripheral neuropathy, we can found in patients of even in the impaired glucose tolerance state. And retinal nerve fiber layer thinning is a neuropathy. So in this study, we have studied the peripheral neuropathy and also the retinal nerve fiber layer thinning in peripapillary region. So aim of our study is to estimate the incidence of peripheral neuropathy among patients with type 2 diabetes mellitus and to determine its role as a risk factor for presence and severity of diabetic retinopathy. We have studied for a period of starting from January 2021 till June 22. It is an observational cross-sectional study, and we have 3 groups. One is control group of 50, case total 100. Within it, there is DM without DR 50 and DM with DR 50. We have done many investigations. Among them, 2 specific investigations are nerve conduction velocity, and another is OCT for RNFL study. We have some inclusion criteria. Within it, we have only included the patients who have suffered for diabetes less than 10 years, and age, we have age limit of 35 to 70 years, and patient who give prior consent and with clear refractive media. And patient, we have excluded the patient who have suffered from acute complication of diabetes, non-diabetic renal disease, other cardiological disorders, glaucoma, uveitis, ocular hypertensions, and moderate to severe PDR. Then we have done the statistical analysis and we get the results. So here are the results. We get the result that motor nerve, upper limb, and even the lower limb, latency was increased in both the group, second, that is DM without DR, and DM with DR. In the third group, that is DM with DR, the latency was increased more. And when the amplitude was decreased in second group and third group, that is DM without DR and DM with DR. But the more decrease of amplitude was present in DM with DR group. This was also the same result we have found in sensory nerve upper limb and lower limb, both in latency and amplitude. Another result we found that OCT RNFL peripapillary layer thickness was thinned out in both the groups, that is DM without DR and DM with DR. But the thinning was more in the third group. Even the thickness was around 63 to 72 micrometer in this range. So we can conclude here that we have found some positive correlation between decrease in peripheral nerve conduction velocity with increased severity of diabetic retinopathy, and another positive correlation between decrease in OCT RNFL thickness with increased severity of diabetic retinopathy. So we can conclude that both the peripheral nerve conduction velocity and OCT RNFL can be used as a marker for prediction of early neurodegeneration in diabetic patients. And we have some limitations. I have a small sample size, and this is single center study. There was always a hospital bias, and it was COVID pandemic period, so I cannot include the diabetic nephropathy patients. These are all my references. Thank you.
Any questions?
So did you do OCT RNFL in all the cases?
Yes, sir, in control group and even case, all
Diabetic
cases.
retinopathy and without also?
Without, right, sir.
Right. So you found out the difference in the thickness in the RNFL.
Right, sir.
And
I have taken the average values
right,
of 4-quadrant.
right. A good study.
Thank you, sir.
What is the clinical implication?
Sir, we can use the OCT RNFL thickness and nerve conduction velocity as a marker, right? Even in the impaired glucose tolerance state of diabetes, early state of diabetes.
But both are confounding factors, right? That neuropathy and retinopathy,
Right.
both are related to the duration of the diabetes usually.
Yes,
and
sir.
Latent diabetic patients will not have a neuropathy problem. Do you have, any data? Latent diabetes, not undiagnosed diabetes, have a neuropathy problem with the delayed nerve conduction velocity. So if such a thing is there, probably your study has a role. Otherwise, both are confounding factors, neuropathy and retinopathy. That's what I.
Excellent presentation, Dr. Vaishali. Now I
Thank
thank
you.
you. Now I